I'm a family physician and seen health services in the U.S., Africa, Asia, Latin America, and I can tell you that good governance saves lives.
The most important thing is that necessary leadership to bring in whatever comes around within the country. They should be playing the lead role.
Those that have most needs get the least and of lowest quality. That's why you need good governance to reverse that.
The governance is not only rules for game. It's really this is the process and also instrument to humanize the organization and the systems according to the stakeholders' value and also consumers' value.
We can do a much better job, perhaps, in many countries in the process of developing better governance to get the voice of the people taken at large. Many different parts of the population in many countries are being left out of the conversation.
One of the areas where I see value in Rwanda's health governance system is the fact that the governance chain, it's often not just about health. It's a government-wide, country-wide sort of approach.
Governance is important at every single level. At the government level, at the level of institutions, it's important at the level of healthcare workers, but also at the level of the users.
Governance is moving very fast. It's a very evolving area. It's no longer providing stewardship as it used to be before, where people look into the accounts, look into annual reports, and look into annual audit account and say everything is perfect. But we are asking board nowadays to provide strategic direction and being able to think that global, not just focusing on the daily today issues, requires some resources.
Within the broad area of governance in health, we're looking at 5 key issues. Women in leadership positions, and it's really clear that having strong women leaders in health really improves governance and moves forward the health sector.
In every dimension of the work with the governance and health system strengthening, we have to be very aware of the need to have women represented.
We're looking at corruption in a very straightforward way. Corruption is a universal phenomenon. Wherever there's humans, there's human failings, and we're looking at what can be done on corruption, and there's a lot that can be done.
We have to pay attention those marginalized population, including indigent population, disabled people, mothers, women, and children, who are really marginalized from the systems. That's why they don't want to use health services because there is so many corrupt, governance issues.
When we look at the health sector, especially when it comes to governance for health, the biggest challenge right now is ineffective governance. And what we put in ineffective governance is a range of issues like lack of accountability.
We're looking at decentralization in health, the dynamics of building good local relationships. We're looking at technology.
We define the term e-governance came up a few years ago. It's really about the strategic use of online technology to support the governance process.
From a mobile tech perspective, we get really focused on devices and on user behavior and on infrastructure, but the governance level is truly the level that will sustain these initiatives. And truth be told, if those institutions and those individuals aren't empowered with the right kind of information, it can become another scary, silly program that the minute that someone leaves, the program is abandoned.
There's some wonderful tools that have been developed to help boards of directors and also at the front line to measure the impact of governance improvement.
Because at the end of the day, we're doing all these seminars, we're doing all these roundtables, we're making all this effort to improve the health of those who get our services, and that's what matters most. That should be our mission, and when we focus on the mission, we should be able to divide the processes, put in place the procedures to provide a better healthcare for the people who need it.